marvelous opportunity here this morning to discuss some events of the early years of the Society for Vascular Surgery with Dr. Harry Shumacker. And since Dr. Shumacker is one of the two surviving charter members of the original 31, I think we are going to be in for a very exciting time. Dr. Shumacker, having written a book on the history of the Society for Vascular Surgery, you know better than anyone else are able to fill us in on some of the details that some of the younger men in the society and some of the non-members, the younger people, don't really have had an opportunity to look at. Maybe you can tell us about the early days. How did it begin? Where? Why?
Well, I'm not sure I can do it better than anyone, but I'll do my best. Actually, I'm sure the society would have started anyway. Just when, I don't know, but it was something that had to be. But it came about primarily because of the zeal of a Washington surgeon who was interested in what there was then of vascular surgery, named Ross Veal. Ross had his surgical training in New Orleans. He moved to Washington and established a practice in surgery. His interest were primarily in veins. Well, there really was nothing much that was being done in vascular surgery. This is in the 30s, except for sympathectomies and vein ligations and vein stripping operations. And he wrote a number of papers, particularly about venous articles. I remember one about superior vena cava obstruction. He was active in local societies. He knew some of the people on Capitol Hill. But shortly after he left New Orleans, in the latter half of the 30s, he began to dream about a society of people who were interested in what he considered a beginning vascular surgery. And he spoke with people in New Orleans. Al Locks knew about it. He spoke with me about it. But nothing much was done. The war came along. Many of us who were to be active in this new society were in the military and hardly available. And so he got together a group in Hot Springs, Virginia, at a meeting of the Southern Surgical in 1945. At that meeting, there were a number of people. Jimmy Allen, who was at times chief at the Massachusetts General on the East Service when Lincoln Davis was away, joint chief with Leland McKittrick. Isaac Bigger from Richmond, Arthur Blakemore, who was at the Presbyterian Hospital. He was a Hopkins man, a good friend of Al Blaylock. Barney Brooks, who was professor at Vanderbilt. Mems Gage, who was a prominent surgeon in New Orleans at the Charity and the Touro Infirmary. And George Lilly, who had come from New Orleans to Miami and established a practice there and was a prominent person in that city and was interested in what there was of vascular surgery. And Ross Veal. As I say, I was still in the Army. I'm pretty sure that Mike DeBakey was still in the Army, and we weren't there. We knew about this gathering, but they decided that it was something worth going ahead and that there ought to be another meeting arranged so that the society really could be organized. And this was done, in July of the next year. At that meeting, there was Mike DeBakey, Dan Elkin, Norman Freeman, who had come from Philadelphia and had been given one of the 3 vascular centers. Dan Elkin had one, Norman Freeman had the one out on the West Coast, and I, when I came back from the Pacific in '44, was opened and directed the 3rd and last one at Galesburg, Illinois. Then there was Emil Holman, who was professor out at Stanford University, John Homans, who was one of the professors at the Brigham at Boston, and Bob Linton, who was across town at Massachusetts General, and Al Oxnam, not Al Blaylock, and Gaza de Tackett's from here.
It's quite an impressive group of giants.
Yeah.
It turned out to be giants in
Right.
vascular surgery.
It's interesting that at that first meeting, George Liddy remembered that Arthur Allen had said that the problem of post-phlebitic ulcer had been solved for all time by Bob Linton and his operation. A little optimistic. And it was at that meeting that Barney Brooks reminded people that they were talking about veins and arteries, but they had failed to talk about the most important part of the cardiovascular system, namely the pump, the heart itself. And at the beginning, there was no distinction made between cardiac surgery and vascular surgery. So they drew up a list of 31 charter members, and most of those 31 did maintain some sort of interest in the developing new field. You asked why it started? Well, it started because there seemed to be a need for it. And it must be hard for the young people in the organization to understand, but one of the purposes of the society really was to acquaint the doctors in the medical profession that something could be done for patients suffering from peripheral vascular disease and heart disease by operative methods.
Harry, I want you to tell us about the early officers. I think you told me a very interesting story about the need for a treasurer and your passing the hat story.
Right. Well, the early meetings were really very interesting and quite different from the current ones. As I remember, well, most of the early, they always met in conjunction with the American Medical Association. That was done on purpose. Perhaps one purpose was to avoid another trip away from one's work. But one of the main purposes, at least, was to have a forum, a group of people who would listen to the papers that would be presented, people who would come in and be educated by this small group in the society as to the existence of something we chose to call vascular surgery. And the meetings were held, as I remember it, in the afternoon and evening, so we could get a larger attendance. And that the programs were arranged quite differently, too. As a matter of fact, I think that the first program was arranged largely by invitation. I think that the program committee simply called a number of us and asked us whether we wouldn't give a paper. And I think there were 9 papers on that first program. I brought along this book, and it has the programs in the back. But the papers were presented informally, and then in that evening session, if I remember correctly, there was a discussion period, and the doctors who were not members in the audience were invited to ask questions, and there was some interesting conversation. At the first meetings, quite a few of the original 31 members came, but certainly not all of them. And we used to have a luncheon, which constituted the executive session. Well, there wasn't much business to transact, and so we had wonderful stories, Cajun stories from Al Oxner, and if Mims Gage was there were even better ones. In the same vein, these lovely Cajun stories told with a proper accent. But we did transact what business there was. And at the first organizational meeting, when they elected Al Oxner as the first president, they didn't elect a treasurer, not thinking it would be very important. But at the first meeting, as I remember, they decided we do have to have a treasurer, so they elected me. And the way I kept the treasury during those early years was really quite simple. We didn't have any money, we didn't have a bank account, and we had no expenses except the lunch. So we would have lunch, and I'd call the waiter over and ask what the bill was, and add a tip and divide it by the number of people who were sitting around the table, and reach a figure that would cover the cost of the lunch and the tip, and pick up someone's hat, because I never had a hat, and walk around the table and ask each person to put in it the $2.75 or $4.21, whatever it was, and I'd give that money to the waiter. So now the treasurer had a zero balance again.
You had no problems with the IRS back then, I take it?
IRS wasn't really interested. It was really good fun in those days.
Tell us, what do you think, Harry, in your estimation, have been the 2 or 3 major advances in vascular surgery during your lifetime, and certainly during the lifetime of the Society for Vascular Surgery?
You asked me, Cal, about one of the most significant things, the introduction of anastomotic methods in the case of obstructed arteries. And then, of course, the use of grafts to bypass obstructions. Thromboendarterectomy, as you know well, was introduced in Spain by Dos Santos. His first case actually wasn't a case of arteriosclerotic obstruction. It was an old arterial thrombus that he removed, but the principle was there, and people began to do thromboendarterectomy. But over the years, it became clearly recognized that this was principally applicable in large rather than tiny arteries, that in proximal lesions, consequently, rather than more distal ones, and that altogether it had a rather limited use. Wonderful use in small segmental occlusions, say in the renal arteries and places of that sort. That was, incidentally, a contribution of Norman Freeman, the value of renal thromboendarterectomy and hypertensive disease.
We're getting more involved in socioeconomic events, and in particular trying to support young surgical investigators. The Lifeline Foundation, what are your thoughts about the Lifeline Foundation?
I think this is a very worthwhile move on the part of the Society for Vascular Surgery. to try. Doctors have done very well, and I think it's quite right for the society to ask doctors, particularly those who've done well, who've made some money, to share some of it and help young people become investigators and do investigative work.
Now it's our 50th anniversary. Would you like to predict the future? Will the Society for Vascular Surgery have a 100th anniversary, do you think?
Oh, I'm convinced it will. Just what it'll be like, I don't know. One of my fears about not just this society, but all of our societies, the American Surgical Society and all of them, is that I just hope that with the phenomenal growth of knowledge in new fields like biochemistry and molecular biology and particularly with knowing more about the inner structure of the genes and how to manipulate them. I just hope that our meetings won't become so overloaded with the new fundamental scientific advances that they will cease to be of interest to people who are taking care of patients, because our primary job as doctors is to treat patients skillfully, compassionately, and well, and to pass on this ability to young people after us so that they in turn do the same. And I do hope that the programs will maintain enough what you might call ordinary clinical vascular surgery to keep established vascular surgeons and young ones interested in their primary job. The advancing of surgery is another necessary attribute of surgeons, particularly those of us who have associated with universities and other teaching institutions. And yet it's the knowledge that may come out of this new field of investigation hopefully will improve the clinical work we'll be doing someday.
Yes, I think that's a very, very sage observation. Harry, finally, what advice would you have for young vascular surgeons just embarking upon their practice?
Well, I would just say go ahead with confidence and enthusiasm. If I were a young man, I couldn't ask for a better life than to be a doctor, more particularly to be a surgeon, and even more particularly to be in the field of cardiovascular disorders. I think it has been a great, wonderful opportunity and challenge, and I think it will remain so. And that would be my advice. Do what you want to do, but don't lose confidence, and don't, I don't know what's going to happen to medical practice, but I can tell you this: I've worked under almost every system in the world. You have too. I mean, in the Army, you don't have fee-for-service medicine. You don't get paid every time you operate. You don't lose money every weekend you don't work. And your patients don't have free choice of doctors. But it all went well, and patients are treated well. Doctors came out of it all right. I've worked under every system that you can imagine, and the only thing that mattered to me was taking good care of patients. I think that's where the fun of it is, and that's where our obligation is. So I'd say, young folks, go ahead and don't worry too much about it.
We've enjoyed this interview very much, Dr. Shumacker, and are delighted you could be here to join us. and hope you'll be here for many, many years hereafter, because after all, you are the oldest member of the society. I think you beat Dr. DeVakey by about 4 months.
Yes, I'm his senior. I think I am the oldest member, and I'm probably one of the happiest members. And I'm delighted to have had this chance to talk with you, Al. There's nothing that's more pleasing in a person's memory than the recollection of the beginning of worthwhile things. And I have been a very lucky man. I've been able to participate in the birth of some of these organizations that have been good influences in the taking care of patients in our age. Thank you very much for giving me this opportunity.